Hello, everyone. My name is Megan Wilden. It is my honor and pleasure to be the Executive Director of OLLI, the Osher Lifelong Learning Institute at Berkshire Community College. For those of you who are new to us, we are a member-powered program that provides educational, social, cultural, and volunteer opportunities designed especially by and for people 50 years and better. We offer year-round classes, lectures, special events, shared interest groups, and more in the Berkshires and beyond. Just a few housekeeping notes. This program, as I mentioned on the chat, is being held in the webinar format because we have such a great turnout. Almost 400 people have signed up from all over the country, as you can see. This means your microphone and camera are turned off, so you can relax. If your dog barks or you're still in your pajamas, we won't tell. We very much encourage questions and comments throughout the program, and they can be entered in the chat box, which is found at the bottom of your screen in most cases. Those will then be addressed at the end of the program. In addition, we have turned on Zoom's live captioning option for those who find it helpful. If you would prefer to turn it off on your screen, you can do so, again, in most cases, at the bottom of your screen where it says live transcript. You can also make the font larger there if you'd like, and you can click on the live captioning text itself and move it around the screen to wherever you prefer it to be. It's a very handy feature. We are absolutely delighted to partner with Villages in the Berkshires today to present this program on the Villages movement. OLLI has been a proud partner of Villages in the Berkshires since its inception, and its co-founders, Howard Shapiro and Carl Schuster, were and are active OLLI members and volunteer leaders. It thus brings me very great pleasure to now introduce you to Howard Shapiro. Howard?
Good afternoon, everyone, and it's my privilege and pleasure to be here with you today. And I thank Megan for the introduction, and we are thrilled to be partners with OLLI here in the Berkshires and hope that those of you who are attending from other places see the value that we have found in working together with a Osher Lifelong Learning Institute program that exists here in our community. As we begin, I'd like to start by sharing with you a very brief video before I introduce some of our guest speakers that I think sets the tone for today's meeting. And I'm going to ask Ray Langsdale to give me some help in getting that video going. Ray?
And I think that's related to another question, which is here in the Berkshires, we have a Villages of the Berkshires with a second one about to come online. What do you think about this Villages model of seniors and self-help as a way to address living at home successfully?
I see countless innovations out there to remind you to take your meds. I've even seen, some of you will get a kick out of this. I've seen countless students come up with walkers that have got GPS designed into them. The Village movement from my colleagues across the bridge at Beacon Hill Village, I believe is one of the greatest innovations in aging in decades. That, along with the PACE program and the like, are some of the true ideas of how we can come together as community, as policy, and the like. So the bottom line is, I think it's a great thing, and every one of them is different because every community is different.
Okay, so for all of you.
Thank you very much, Ray. And I think Joseph Coughlin, who is a professor at Massachusetts Institute of Technology and running what is known as the Aging Lab, really says it all. But we have some wonderful speakers to share their experiences working with villages throughout the country and here. Let me introduce some of our participants and then we'll turn it over to one of them to start. Gina Pagluccia Morrison is the Executive Director of Beacon Hill Village. As Executive Director, Gina wears many hats, including managing the day-to-day operations, overseeing a small professional staff, coordinating fundraising and development, and collaborating with the member-led board and other committees to execute strategy. Prior to joining Beacon Hill Village, Gina had required extensive experience in working with older adults and an understanding of the challenges and issues associated with aging through a variety of community-based volunteering opportunities at several elder service agencies in Massachusetts and her local Council on Aging, as well as acting as an ombudsman for a Winchester-based nursing home. Jeannie has a Master's of Business Administration. Before moving into aging services, Gina had over 25 years experience in consumer research and business strategy consulting, where she helped retail and financial services companies develop growth strategies and improve the customer experience. She'll be followed by, and Gina might say, as Beacon Hill Village, if you don't know, is the first village that was developed in this country. She'll tell you more about that. Gina will be followed by Barbara Hughes Sullivan, who is the National Director for the Village to Village Network. Village to Village Network is the national association that represents 350 villages throughout the United States and 4 countries around the world in the Village Movement's model for aging. Barbara's training was in business administration and marketing. Her career began with work in the retirement movement. Prior to joining Village to Village Network, Barbara worked with Mount Vernon at Home, a village in Virginia, first as an advisor, then a board member, and then as its executive director. She's received many awards for her work in the field of aging. Barbara and her husband raised 3 boys, and she now resides at the Jersey Shore to be closer to her children and grandchildren. Gina and Barbara will be followed by Carl Schuster and myself, co-founders and President myself and Vice President Carl Schuster. And we'll talk about what's happening here in the Berkshires with development of villages. With that, I'd like to turn over the platform to Gina to begin and tell us about Beacon Hill. Gina?
Thank you, Howard. Thank you, Megan, for the great introduction. And who we haven't heard from, but who's behind the scene is Carolyn King, and she's the executive director at Villages of the Berkshires. And I'd like to thank her as well for inviting me to be here today, because this is so much fun. I love talking about what we do. We meet monthly as a group of villages in Massachusetts, and we love sharing ideas. So this is kind of fun for me. So I'm going to share my screen, and hopefully I do it as smooth as everybody else did. And I just have a handful of slides to tell the Beacon Hill Village story. There we go. So Howard is right. We're kind of where it all began. We're about to celebrate our 20th anniversary in 2022, which is absolutely amazing. But the start of the village movement began in 1999. It really was a group of folks, about a dozen or so people. They lived in Beacon Hill. They were friends, they were neighbors, and entrepreneurs. I mean, to put together such a novel concept. But they thought about the future. You know, they loved living in Beacon Hill. They loved their lives and everything they had built up, but they looked at their parents and their grandparents, and they saw how they aged. And often there was visits to the nursing home or other retirement care facilities, the loss of control, the inability to make decisions on their own, and really not thriving as they aged. So they wanted to do something better, you know, avoid those challenges, stay in control, make their own choices, and really see aging as a positive, as this is where we're gonna, you know, live even better than we've lived. So the concept, you know, all these terms were just different. The idea of a virtual village didn't even exist, and aging in place was a new concept. And today it's so common sense. But the idea of a village then was, you know, older adults coming together, sharing skills, supporting each other, using their talents and expertise and their backgrounds, their lives where they had so many different experiences, professional and otherwise, and come together to address the challenges that we all face as we age. So this idea of aging in place became the term. They all wanted to stay in Beacon Hill. It's a wonderful community and neighborhood. They love their homes. And you'll speak to these folks today, and I'm amazed because you'll hear, I've been here 50 years, 40 years, 30 years, and they still don't want to move out of Beacon Hill. But aging in place, if you had to give a definition, is this idea, the ability to live in your home and within your community, independently and comfortably. So you do that regardless of how old you are or how much income you have, your ability level. That's kind of the broadest concept as we think about aging in place. And this is a quote from one of the original 12 founders is, we looked ahead into the future and we said we wish to make changes. And I just love that quote. So this idea of what was the village model was really, think about this, 2002. So that, like Joe Coughlin said, this is a very different way to think about aging. There were, retirement communities of some sort, there was the nursing home, but this idea of a grassroots organization just didn't exist. An organization started by older adults for older adults, and it was self-governing. They created a board of directors and policy. They hired an initial founding executive director. I'm only the third in 20 years, which is amazing, and a very small part-time staff. And then the board members were from the community, and the board members even today are members of the organization. So they didn't choose business people or members of the community that weren't part of this tight-knit. And everybody would be actively involved. Self-supporting, true at the beginning and true today. We have no state or city or federal funding. And our income, again, then and today is really for membership fees, which is about less than half of our total operating income. Donations is a large source of our income, and a small portion comes from private foundation grants. And those are specifically to support our subsidized membership program, which offers deep discounts to the low and moderate income Boston residents. And you could see, I can't seem to go forward every time I move my slides ahead. Consolidating services. So one of the things they thought of was, we're not going to create services. We're not going to hire service providers. We're going to use what already exists in the community. So they worked with Mass General Hospital in Boston to create a network for healthcare services. There was a company, Houseworks, that enabled them to get access to home health aides, home modification, the kind of things you need to take care of your home and to take care of your own personal health. And then they looked around and said, well, obviously we're going to maybe need some other things. So let's identify maybe, the electricians and the plumbers and other service providers. And if we can negotiate group discounts, we'll do that, and we'll share these resources. Volunteering was key from day one, and it is today. The committees, the board, the activities are all done by members volunteering many, many hours. So it was volunteering to do what we call the work of the village, but then volunteering to help neighbors. And we have always had this focus on the whole person. They refer to it as mind, body, and soul. Address the programs to be social, to learn about the culture, take advantage of everything that's in Boston, and wellness, which is access to fitness, household help, home care services, community, et cetera. So it was the entire person as we age. This just gives just a sense of, if we had to create a picture of the model, and it doesn't really do the greatest job, but it's so encompassing what village is. I mean, it's Beacon Hill Village, but really I think any village brings these kind of things. What do you need if you want to age well and age in your community? Well, you need access to social and cultural opportunities and the ability to take part and participate in your community. You need access to home care if you need, something repaired. Healthcare if you need to take care of yourself, or home health aid. Sometimes you just need an errand run or somebody to pick up a prescription, or maybe you've been sick, you've returned home from rehab or the hospital and you need somebody to do your grocery shopping. Information and education, aging has so many challenges and opportunities attached to it. And a lot of what we do is create opportunities for people to learn. Before the pandemic, of course, we all faced going virtual, but on the education side, we have a great relationship with the Boston Public Library. And we created a program called Living Well, Ending Well, which is exactly as it sounds, living well as you age and making decisions towards the end. But we created this program for the whole Boston community, not just members. And we were holding these monthly series in the library physically with healthcare experts from, the experts in cancer, the former director of Dana-Farber, eye care, healthcare, bone care, so that people can have the information they need to know about staying healthy as they get older. And I just have to give just a vote for all of us in Villages that this past year and a half just really brought to light how important our model is. We turned on a dime, as so many villages did, if they were able to stay open. While we went virtual, we were delivering groceries to beat the band. We were providing the Zoom education, the Zoom cultural. People got together to form all kinds of groups, and we all became Zoom experts. And so many people said, I don't know how I would have gotten through the past year and a half without the village. And I'm sure they think about that when they think about being part of such a community. So I think it has never been more important to be part of this positive community as it was this past year and a half. So this is just kind of a funny slide. A little bit like where we've been and how we talk about ourselves. And I think we continue to evolve. And I think if I keep extending the timeline, I'll keep changing the words. But we started in 2002, the phrase was about aging in place. At our 10th anniversary, we talked about aging in community. And this, I love these photos. So I don't know if anybody can recognize this, but in 2017, you'll remember after the election, there was all those protests. And this was the Women's March. I think it was in January. And that woman on the bottom with the blonde hair is indeed Susan McQuinney Morris, who's one of the founders of Beacon Hill Village, wearing a pink hat. And it says nasty old women on the back of their shirts. So the idea is that it's, we really want to be part of changing how aging is viewed. It is not about becoming decrepit and old and decline and all the negative things. It can be about the positive things. It can be about the opportunities and now taking advantage of everything in your community and everything that the other members can bring. So I think you'll see us continuing to evolve there. So this is who are we today? This is as of the end of May. We're about 361 members, and those are the age ranges 54 to 99. And we have one 99-year-old who's going to turn 100 next month. And every time we talk to her, which is weekly, she will tell us and remind us that her birthday's coming up. Delightful. I mean, she is a perfect example of aging in place. She's not out and about joining our programs, but she gets weekly groceries. We've connected her to a home health aide. She gets around with our drivers. She speaks to our staff. She tells us all the time how she could stay home and not have to move into any kind of retirement facility because of Beacon Hill Village. We're about a third, in terms of overall members, about a third men, 2/3 women. And across memberships, about a quarter are made up of households and the rest individuals, and 20% of our memberships are subsidized. And so that low end of the range represents an individual subsidized membership. And that's what we support through our grants. And this is this cool picture that one of our members created, putting in the zip codes of all our members. And we are in a process of working on our own messaging in Boston and across our communities to say, you know, we started in Beacon Hill, but we're not just in Beacon Hill anymore. The numbers are people. And so you could see we almost have little villages around town. You know, we have a big clump of people who live in the Back Bay, a bunch of people in the South End. And this ellipse, if you will, goes from the north end of Boston all the way down to Fenway. And we always say from the Charles River to the south end on the other side. It's hard to overcome our brand. We have a really strong brand, but people sometimes call us up and go, I think I'd love to join, but I don't live in Beacon Hill. Can I still join? So we're working on our membership, our messaging, and telling people we welcome you across Boston. And I think this just does a great job of showing our footprint. And finally, just reiterating the things that we do and just kind of showing it through pictures. You know, the mind, body, and soul is so much about people getting together socially. You know, we used to do the coffee hour and together, and we're going to get back there. We had men's first drink and lunch out once a month, dinners out once a month. We had fitness in a community place around the corner. We connect people to resources and information, to tech providers and tech volunteers, and to our drivers. And then finally, you know, we offer lots of venues where members can get involved in the community. That lower left picture is from a Beacon Hill. They do a Hill Fest, which is kind of on the hill where they block the streets off, and a lot of organizations get together and tell their story. So I would say that we are delighted to have been the beginning, but have been amazed at the wonderful villages that have developed after us. And truly, you see one village, what do we say? You've seen one village. We all look really, really different, but we share a mission of helping you age positively, healthy, actively. And I think it's, you know, the outlook is great as we look ahead and hopefully the next 20 years. So look for us to see, we're creating thoughts and ideas on how to celebrate our anniversary next year, and looking even to Barbara so that we could celebrate all villages. It's not just about us that makes this movement important. It's about everybody that came after us that is expanding it and really making this an asset for everybody. So thank you. That is my last slide, and I will stop sharing my screen.
Thank you very much, Gina. And now, Barbara, if you'd like to take over and tell us about the broader picture of villages across the country.
Second. There I am, and there I am. Hi, everyone. I am so thrilled to be a part of this. Thank you so much for the invitation. Let me just get my slides going here and all the other stuff out of the way. Hang on. Here we go. So I first want to thank you all for inviting us. What a great opportunity, as I mentioned. And Gina, that was an awesome presentation. You really showed a lot of what I went through as a director, early director in 2009, you know, the challenges and then how we all started. So thank you very much for your presentation. Just going to go through a little bit of the demographics of aging. You know, this is part of a ARP, the census came out. And I love showing this slide because you can see in 1960, the pyramid. Look at in 2060, what's going to happen. I meant 1960 to 2060. Look at the demographics and how they changed. By the end of this decade, 1 in 5 adults will be over 65. We know that. We know that there are more people over 65 than under 18. It is a growing and the fastest growing segment. There's also an increase in diversity. And we look to, as the national network, we look to see how we can expand our model for aging in community and service as far as the best practices in our model in other areas. and outreach. And I think, you know, the statistic of women living alone, 55%, and that's even growing more. I think, Gina, you mentioned you were a third men and 2/3 women. So it pretty much, you know, goes across the board, this demographic. A 2018 study by AARP did a little study, and it was a home and communities preferences survey of adults 18 and older. And surprise, surprise, 8 out of 10 adults age 50 and older want to stay in their homes. So back to Beacon Hill and the model, we all know that they want to stay in their homes, and how to do this, and the choices that we used to have, and now the choices, and especially in light of COVID, the choices we have now as we are having older adults. What are the components of successful aging? We look at this, every community looks at this: safe, affordable housing, accessibility. All of us want community engagement, being involved, how to do it. And villages are successfully navigating, as Gina said, not duplicating, but, you know, enhancing existing programs and getting the outreach to underserved and uninformed older adults. We've all had an emphasis this last 18 months on health and well-being, more so than ever. And so the villages concentrate on how to emphasize that health and well-being within the community and within individual homes and the villages. And, you know, we all strive for independence and autonomy. Just because somebody gives up driving doesn't mean they're not independent. It's just a choice, and there's alternatives. It's not just the volunteer and the member, but it's the partnerships with Uber and Lyft, you know, GoGo Grandparent, and how to be as independent safely and successfully in your home and in your community. Why villages now? Villages are very cost effective and scalable. As we know, all the villages are pretty much grassroots. And I'm going to talk about the different types of villages that are out there and what's emerging more and more. But for the most part, they're community-based, grassroots, organized by volunteers, looking at the needs of what the community has and what they really want as they age. The services range from each of the villages, whether they give transportation or, you know, we have villages out there that are just all volunteer. But also the services reflecting the needs of members and responsive to the changing needs. In other words, you know, we host at the National Network every second Monday, don't quote me on that, I think it's the second Monday, a mentor group. And then the next day it's followed by Frail Members, which is hosted by Capitol Hill Village. And inevitably the questions are, well, I have a great member, but they are now and need more services. How can we adjust to help them and keep them as a valued member of the village, but maybe we can't meet some of their needs? How do we, you know, respond to their changing needs? And so these are, along with partnerships. I know Gina mentioned, you know, helping that 99-year-old woman to, you know, to find a home health aide. That's important, and it's a role that the villages are taking on, are the partnerships and the other organizations that they can partner to help our folks stay safely at home. Even before the pandemic, and especially during the pandemic, we know that villages reduce social isolation. And how they do it, even through the pandemic, it was the letter writing. I heard from villages throughout the country, the phone trees, you know, the calling trees, dropping off the groceries, just having a visual and eye contact, what I call the touch, is an important part of reducing isolation. And just seeing a human face, a friendly, phone call, it helps reduce that isolation. Zoom has been wonderful for those who can do it, but we still have a population out there that don't want to do the technology. So it's back to those grassroots efforts and the ability to connect with them the old-fashioned way. Supporting our local businesses and the economy. There are so many villages out there that partnered with restaurants and grocery stores and pharmacies. And that's what villages do. They take that local community business, that local business, and they say, hey, we have a little fundraiser and we want to deliver food as part of our fundraiser. We're having a Zoom, and they deliver the food, or the weekly grocery, that the business will do. The pharmacy that was doing, the vaccines. Again, it's villages partnering with these local businesses. Expanding the access to work and volunteer opportunities. We would not survive as the village movement without our volunteers. And during these last 18 months, I'm going to tell you, almost 18 months, the number of volunteers that came out of the woodwork across the country, because one, they were home, because they wanted to give back to the community. It really was a dawning of a new day, with a lot of new volunteers that wanted to help their neighbor. That's the bottom line. And providing access to transportation. Again, I think the statistic back in 2018 when we did the survey, 2019, sorry, was that 67% of villages offered volunteer transportation or some type of alternative transportation, whether it was a paid driver, or a lot of villages partnered with Go-Go Grandparent to do their transportation needs. But that's a big number. That was like the #1 service request most villages have. The village movement. I just talked about the role in reducing social isolation, but also connecting with public health. We had, the network had a great webinar about 2 months ago with N4A, which is the Area Agency on Aging. And it was great to listen to some of the villages who are really partnering with the AAAs and some of their public health officials to see how they can expand community-based services. And I know that this is a big tickler with the Biden administration. We are in the forefront as far as the village movement and the village model to show that we're successful in connecting in that basic community need. So we continue to push our villages to connect with existing organizations, aging organizations, other nonprofits in their community to expand the opportunities for some of our older adults in the communities. And the village initiatives, again, right across the board. And so we mentioned we have 350 villages out there existing. 280 are open and operating. About 80 are in development. And these villages are, some of them opened during COVID, about 30 of them opened, started developing during COVID and jumped on the opportunity to look at this model. But we have other village initiatives like, graduated fee schedules, initiatives towards diversity, equity, and inclusion within their own communities, partnerships with ethnic and cultural organizations and faith-based communities, collaborations with public health community, insurance programs, and other senior serving organizations, as I mentioned. about 76% of villages reported that they partner with some type of government agency in their service area, or that they are aware and working on trying to establish some of these initiatives. Advocacy. So, the network itself is twofold. It's not just the, as we call the village commons, where we have new villages come and do the mentors. They, take advantage of the Village 101 toolkit and helping them, through that 18 to 2-year process of organizing, developing, and then opening their village. But we really encourage our villages to start working more in the advocacy for, livable communities, for more community-based services, easier access for everyone, not just the very, very poor or the very, very rich. It's for everyone. And how we can scale this into communities of different, races and colors. And so this is advocacy. This is on housing. I don't know if Howard, you mentioned or saw, we've been in conversations with the Brookings Institute, and we were on a panel. We had a convergence report that came out. It was listed in our network, but it was input on public policies. And we were very privileged to be a part of this, program. It was back in October, and then again, we had another one a couple months ago. And it really emphasizes the need for the villages, for housing, for transportation, and how we can all come together at the community-based level. So again, I go back to the advocacy end and look at how we can make our own communities better and expanding out. Leadership, again, I talked about the master plan. Everybody's heard about, or I hope you have, the master plan for aging in California. They've done some great strides. The villages are actually mentioned in the California master plan, but also states like Virginia are starting to have conversations. The governor's council was just talking about that last week. There was a big conference on the governor's conference, and how villages can start being a conversation in these master plans. I will take a minute and talk about the overall, kind of statistics. I mentioned that we have 280 villages open, 80 in development, 250, I'm sorry, and 80 in development. We have a combination of rural, urban, and suburban, leaning more towards, I'd say, the percentage of suburban villages. But our expansion and our challenge for the network is to get into our rural areas. And hopefully some of our advocacy in the national level will help through either the AAAs to get in some of our rural areas and do more outreach and get people really committed to establishing villages. Of the villages that are open and operating, 60% are staffed. 40% are all volunteer villages. So it gives you an idea of the mixture. We have a growing number of two things. One, of regional groups. I mean, Gina, you mentioned, that you guys meet together in Massachusetts. We have a formal group that actually has been meeting since 2010, I believe, Washington Area Village Exchange. They've been up and operating. There's a huge group in Columbus. There's a big group in Portland, obviously California Village Movement. And so you're seeing these regional groups really take hold and sharing best practices. It's the way, of the future. Last but not least, and in conclusion, I just wanted to say villages are staking a claim in the Aging Services Network. Villages are hungry for the next level of cooperation and collaboration with healthcare partners, aging services networks, communities of faith, municipal governments, and each other, because we know firsthand the power of connection and community to change people's lives. Most of our villages started as grassroots organizations with heartfelt neighbors and a vision for a better way to age. 10 years into the movement, we're discovering the need for strategic planning, professional staffs, proven marketing plans, diversified revenue sources, and a larger context for how villages contribute to the future of aging locally, statewide, and nationally. In the age of self-organizing networks, villages are a revolutionary idea whose time has come. And I'm going to turn my time back to, oh, I'm sorry, I should put this out there. And we're going to talk about the OLLI. It's a great opportunity for partnerships. And I'm going to turn it back over to you all and stop sharing.
Hi, everybody. My name is Carl Schuster, and I am one of the co-founders of our local village. And I'm very pleased to have the opportunity to talk to all of you today and to bring the discussion down to our very rural area in Western Massachusetts. We're 2.5 hours west of Boston and quite rural, with a tourist economy and a beautiful way of life that we enjoy very much. So that there are, I know folks who are tuning in across the country who may live in rural areas. It definitely works to establish a village, and we will show you what our thinking was and what our activities were to get us to where we are today. So next slide, Howard, please. So as we just heard, 20% of the population is going to be 65 years of age or older by 2030. And that means there are 72 million people who are in the same circumstance as, as the rest of us. So we know that there's a tremendous need for information and for organization to meet the needs of retired people in our country in the coming years. Next slide, Howard, please. So what Howard and I did when we were considering starting a village was we went to a survey, a 2-year survey that was done in the Berkshires, having nothing to do with us. It was just fortuitous timing, by the Berkshire Regional Planning Commission, called the Age Friendly Survey. And it is what formed the basis, the statistical platform for what we put together. So on the left, you'll see that in 2010 in Berkshire County, this is the western, most western area of Massachusetts, the one town that had more than 60% of the population over 50 years of age was the little teeny town of Terringham, which is shown in red on the slide. Projected now to 2030, you can see the changes. Now the towns in red showing the same thing, 60% of the population 50 years and older look like it's probably 2/3 of the towns in the state. So we are morphing from a theoretical problem to one that's landing on our doorstep as we speak. And it was this information and this slide and the rest of the survey that really provided the basis for us to conclude that our area was ripe for some kind of organization. Next slide. So, so as we heard before, whether the figure is 80% or 90%, I think in our Berkshire study, it was over 80% of the people who were surveyed decided that they would like to remain in their own homes as they aged. And that's certainly true of everybody who's been involved with us. I think that's nearly a universal desire. So what is Villages of the Berkshires? We're a nonprofit organization. We're a nonprofit corporation, which with our own board of directors and part-time staffing, which we established on our own with the state of Massachusetts, and for which we have gotten 501c3 approval. So contributions are tax deductible. We are county-wide, which is probably a little bit unusual. And we have committed ourselves to what's called the hub and spoke model, which means that we can add towns and neighborhoods at will to our existing organization and thereby maintain a very decentralized administration ongoing through the years as we grow. Members and volunteers join the Villages of the Berkshires. The members who join have full year memberships with services. We have associate members who join just for the socialization without services. And volunteers provide the bulk of the services. Many of our members are also volunteers. Well, we have some volunteers who are not members, and they provide, and we maintain a database of professional service providers for those services that we are unable to provide or would be unwise to provide, so that the members of our organization have contributed to the database with the names of their plumbers and electricians and gardeners and so forth, who they would recommend to others. And I have used that service and it's very useful. We are, as you will hear more about in a few seconds, we are partnering with our OLLI, Osher Lifelong Learning Institute at Berkshire Community College here in the Berkshires for educational, social, and interest group activities. And that provides an important access for our members to continuing education, which is of high priority for so many of the folks living in the Berkshires. So we're residents who take on the mission of helping ourselves help others and fostering our own independence and sense of security and well-being and a meaningful life, and it is happening. So this is a very limited list of some of the services that we provide. There's a limited number of services that could be provided, so that as folks come up with new ideas as to the services they might need, they can just call our office or email us or contact any one of us, and we can see whether or not we have a volunteer that might be able to provide it. So whether it's home repairs, friendly visitor and companionship, landscaping needs, help with personal needs, pet care, transportation, basic tech support and assistance, we're willing to consider almost anything that we can do safely and competently. That will come from the membership, and it has already started. So I'm sure people are interested in what the costs are. So a single membership is for a single individual is $25 per month. So that over a period of 12 months, it's $300. And if a single person is here just for the summer months, as is quite common, if you're a visitor, you're here as a tourist and so forth, but you would like to join in for services, there is a 6-month membership for $150. If you're a 2-member household, the fee is $45 per month for 12 months. So a total of $540 per year. And if you're a summer resident and want to join for 6 months, it's $270. If you are a single person, you want to be an associate member, that does not take down any of the services, it's $100 for 12 months. And a 2-person associate membership is $200 for 12 months. So the benefits of Villages in the Berkshires is that it's a single trusted source for information, referrals, and resources. We have a members-only website with all kinds of information and access to ordering services and so forth. We are providing transportation and rides, which especially in this rural area that has a very poor system of public transportation, that's extremely important, probably the #1 requested service. Home repairs and other assistance in your home. And as I mentioned before, a network of not vetted in our case, but service providers that have been recommended by members. So this is peace of mind for those of us who, before we had Villages of the Berkshires, didn't know quite where to turn for answers about what services were available. And now that problem has been solved. So I'd like to take a few minutes to, if we can put the slides down, and I can just talk to you person to person about my own experience. and why I got involved with Villages of the Berkshires. And it really all started in a conversation with Howard and with his wife and with my wife about how we plan to spend the next years living in the Berkshires, which again is a rural place. And so we don't have all the services immediately available to us. What could be available to assist us in helping us to age in place, to try to not be catapulted prematurely into some kind of an institutional setting. And at about the same time, it was my daughter who lives in Boston who said, you know, you want to take a look at Beacon Hill in Boston. They're doing some very interesting things there. So that's what we did. And then we started Googling and we heard about the Village to Village network. And before you know it, putting that together with that 2-year survey that we had locally, we started to see what was available to us. And that was 3 or 4 years ago. And since then, we've established our nonprofit corporation. We've begun to operate. We've hired our program director, and we're ready for more. So, so the system worked very well for us. What we found, one of the things we found out starting out when we were doing sessions, outreach sessions, to gain the opinion of other people in the community about what we were proposing to do, was that there was in fact quite a network of services for people who qualified on the basis of low income. But when it came to the middle income group in the Berkshires, there was almost nothing available. And so there has been a universal receptiveness to the arrival on the scene of Villages of the Berkshires. I have to tell you that I think I'm typical of all of our members who are very independent minded and really don't think that we need any help and maybe never will need any help. But we're finding as we age that, for example, a few weeks ago, we had a 50-pound bag of bird seed that we really needed help getting down the stairs with. And we also had an internet problem that was ongoing for 10 years in our home with sporadic service. And one of our members came over as a volunteer and in 2 hours restored our service so that we now have perfect internet service. And that alone was worth the whole year's fee. So, so some pretty wonderful things happen when volunteers enter into the situation. I think what we hear the most from folks is, well, we're not sure we're ready. They're still feeling independent. They think maybe in the future they would like to become involved with Villages of the Berkshires. And what we always tell them is that joining up is a little bit like buying an insurance policy. You may not feel like you need it right away, but you better be thinking about it for the future, and you want it to be in place when maybe you're the one where it's going to make a difference as to whether or not you are prematurely having to consider going into an institutional setting. So my wife and I have, for many years, had a small deposit down on a place in one of our retirement communities, and we have no intention whatsoever of moving in there. We hope the Villages of the Berkshires are going to help us remain in our home. That's our intention, and I hope that it provides equal opportunity for others to share that goal with us. So Howard, you want to take it from here?
Thank you, Carl. If I can get back to our PowerPoint. I see some of the questions in the chat deal with the relationship we have with OLLI. Let me just say, starting out, that when Carl and I began talking about Villages of the Berkshires, the first thing that we considered was working with OLLI because they had so many wonderful educational and social programs, and we didn't see any reason to duplicate that effort. We met with Megan Wilden, our executive director there, and learned from the Osher National Resource Center, Steve Thaxton, who I know is on this call, and the then Village to Village executive director, the network executive director, that there were no other villages in the country that had formed a partnership with an OLLI. So they were looking at us as a very unique opportunity. And that opportunity has helped us greatly in moving ourselves forward. And we're thrilled to be working with them and look at the relationship as something that's helpful to both of us, not just from a membership point of view, but in making sure that those who are members of villages have access to what is available through OLLI, whether that is help getting to them through transportation or just knowledge of what events are taking place. So we're quite excited about that. And we're moving that model forward. One important thing about villages is its volunteers. Key to this movement is having adequate number of volunteers to provide the services. And so we encourage anybody who is interested in volunteering to join us and to participate with us. Whatever amount of time you can give, whatever interests you have, what skills you feel you have to offer. And sometimes it may not be a specific skill, but you might be a good companion for somebody as their needs need to be met. There are many ways in which you can help. These are just a few of them that are available, and we encourage you to think about this as something that you'd like to do. As we move forward, one of the things that we were fortunate is to have been a recipient of a national grant through the federal government called the Community Care Corps program. This program was dedicated to just the kinds of things that we're doing, trying to help fund volunteers or provide volunteers who would provide assistance to people who wish to age in place. We like to think of it as not just age in place, but remain in your home as you grow older. Part of those grant funds that we received were utilized to form a partnership with Berkshire Community College and their service learning program, where students who are going through a particular curriculum would provide their services to members of our village. And this took place this past spring and was very successful in the two areas you see listed here. We intend to continue that effort. BCC has been very interested. We're applying for a second-year grant, but regardless of that, we're looking at a continuing relationship and a very successful one indeed. I'd like to take a moment to introduce two people who are on here today. Carolyn King, who is our program director, and Stephen Hager, who is our volunteer coordinator and joined us as a result of receiving the grant funds. Both of their email addresses are here, and they can be reached directly or at the email address that you see below, or the telephone number if you're more comfortable making a call. This is important because our real goal here today is to welcome individuals who here in the Berkshires to reach out to us. And if you're not here in the Berkshires but want to learn more about what we're doing and how we're doing, this is the way to reach us. I'll add to that we have a beautiful website that, thanks to Carolyn King, that has a lot of information about who we are, what we're doing, and you can sign up to indicate that you'd like to get emails from us, or you can use this website to indicate that you're interested in joining as a volunteer or member. If you click on where it says members or you click on where it says volunteers, each of those has a application form for those who want to complete their information and join us in our effort here. And I'd also encourage you to look at the website because you'll find there our newsletters. You'll find back issues and current issues and see the kinds of things that we have been doing. We're a relatively new village, only 1 year old, but a lot of activity has already begun, even in the era of COVID. And we're very excited about that. And you'll also find there a place for our events and the things that are coming up and things that you might want to participate in and join us as we move forward. So I encourage all of you to join us, to participate with us, and we look forward to that. Ben, here's the information about how to reach us. And this is part of our mission statement, living at home with peace of mind. I want to thank Gina Morrison, Barbara Sullivan, Carl Schuster, And I want to thank the OLLI organization for putting this together and providing us the opportunity to share with you just what we're doing. And I'd also shout out to Megan Wilden, who's been a great supporter, and we're pleased to have her participating with us, and the board of directors, and Barbara Lane, who's the president of the board, who's been very supportive as well. And for our program today, I'd like to thank Ray Langsdale, who has been our tech support. It's great to have you available to us. Thanks to Carolyn King for answering some of the questions as they've come up. But Megan, I think you or Carolyn are going to handle questions that have come up if there's more to answer.
Yeah, thank you, Howard. This has been great. We are at the hour mark, but whoever would like to stay on for some discussion, we welcome that. There's a lot of great questions. The first one was from Lynn, and she asked, how would this concept work in a condominium community? And do you want to answer that, Howard, or should we bring some other folks?
Let me ask, maybe Barbara has experience with that happening somewhere in this country where there is a condominium community.
Yeah, actually, there's a couple of them. I'm having video problems, so sorry. There are a couple of them throughout, you find them more in urban settings. We had a board member, Eddie Rivas, who headed one in Arlington, Virginia, but there's one in California called Hotel Oakland, California, and Hotel Oakland Village. And they're actually a subsidized housing unit. It is possible. You just need the management. We tried one here in South Jersey, but you really need an organized volunteer corps to manage it. Some of the buildings in Northwest DC is a good example because, along Connecticut Avenue, there's a lot of high rises. Gina might be able to answer that too, as far as, Boston and some of those areas that have the multiple complex.
I believe there are, we call them nationally occurring retirement communities, NORCs. I don't know if there are people calling them villages in the city of Boston, but the high-rise buildings, actually, if you could get the management, like Barbara said, and the volunteers to pull it off, are kind of perfect vertical villages. Someone on our board has actually like a little mini group in the north end of Boston of people that live in her building, and they do everything in a very local way of supporting each other and being there if they need the help or the errands or the ride. So I think they exist. I don't know if we'd call them villages in Boston, but I think it's possible to get. And I think it's so true what Barbara said, if you can get the group of volunteers to provide the help, the services, to connect you to services and information, it certainly seems possible.
Great. And Karen in the audience notes that New York City has NORC, or naturally occurring retirement community programs, that they're housing, that have housing-based and community-based supportive service since 1986. So that's great. Steve Saxton, who Howard mentioned, is here today. He's the director of the OLLI National Resource Center. Asked, how many members total nationally do the villages have, or do they count? And we know it's just an estimate. I think maybe Barbara is the best person to answer that.
I think so.
So we estimate that we serve, and this was a number that came across that I inherited when I took over in 2018, about 40,000 nationally. And that's a number that somebody compiled with Mather and some of the studies they did, back in 2018. I'm sure it's higher, but we have villages throughout the country that have 40 members or 700, it's just, and do they serve just the members, or are they serving the volunteers? Because sometimes villages, and this is what this whole data collection project we're doing through the national network. And I don't know if you've heard about that, Howard or Megan, but it's great to jump on it if you want to. The DC Villages, Capitol Hill Village, started a taxonomy project to just do some data collection. And this is one of the big areas of talking points. And oh, Joel Shapiro's on the call too, so maybe he can address, well, he's in the audience, but you know, not everybody says a member is, you know, who are they serving? Are they serving the volunteers? Or some of the volunteers are also members. And so it's, we need consistent data reporting is the bottom line. So,
Sure.
yeah.
One of the things that the OLLI network does is they do an annual, we have to fill out an annual report, how many members we have. And only recently did we add, you know, how many non-members did we serve also, since a lot of OLLIs have public programs. So that might be, if you institute kind of a yearly survey of your members, that might help gather that information and to kind of include that estimate of people who are, you know, that you serve who may not necessarily be members.
Well, and also we have villages out there that have associate or friends of the village, you know, they don't necessarily do services, but they do social programs. And so it's a social membership. And do you count them as members that are actually receiving services? So that's where the inconsistency really lies.
Sure, absolutely. So there was some conversation on the chat. I'm not sure if everyone could see it, about home sharing. And Barbara, you mentioned Silver Nest, which I believe is kind of a national, it's sort of like Airbnb, but for renting rooms more long-term, because many people are empty nesters. And so one way for them to both help support themselves as well as to, you know, have companionship, rent out rooms. Did you want to add anything more about that besides what's in the chat? I can't remember if it was to everyone or.
Silver Nest is expanding rapidly, and they're having some, I think, I forget who said it in the chat, but Portland, they're having conversations with the city of Portland. These are definitely jurisdictional. You have a lot of cities or counties that have home sharing programs in place. I know that Silver Nest partnered with Teach for America to get some, which is a great opportunity for, you know, especially low income areas where you're trying to get teachers in, but the housing, you know, the pay is not great. So housing is an issue. And so they're actually going to be a sponsor at our conference in October. So jump on and listen to what they have to say. They'll be in the exhibitor hall. And I saw that Jennifer, if you Google Silver Nest, she is actually talking on the 21st. I saw her, and I can send you the information. I saw it on a tweet today, and I can't tell you, but Jennifer is the marketing and development person. So she'd be, and she's speaking at a webinar. So great opportunity. I'll send it to, you know, Carolyn or, you know, you, Megan. Okay.
Great, thank you. So we probably need to wrap up. There's some other questions that Carolyn was answered that folks had, but I know there's a lot of interest in learning more. And Barbara, of course, is the executive director of the National Villages Association, called the Village to Village Network. And we will send out a follow-up email and have the email address to that. And the nice thing, one of the things they have is they have a place where you can look up all the villages in your area. And if there isn't one, they can help you start one. That's one of the things they do really well, is help provide all the tools for starting a village. Isn't that right, Howard and Carl and Carolyn?
Sure.
They were extremely helpful. One of the nice things that features that Village to Village Network has is a whole toolkit for putting together a village, which I think was the benefit of having Beacon Hill Village and many others that started before us. So yes, it's been a great association, and we're very pleased about that. And I'll take the opportunity, Megan, right now, since we're closing out, to thank you and the OLLI board and OLLI and all for making this possible today and for our relationship. We're really excited about that going forward. Thank you all.
Same, absolutely. We'll be sending out the links, as I said, and also a link to the recording of this. And we thank you all for attending. Bye-bye.
Bye now.
Everybody, thank you.
Bye.